Very good morning, everyone. Let us start with the session. I will try my best to give you all the important topics which were covered in the yesterday examination. We will cover how to crack these INICET examination, MCQs, and how to focus on the keywords, how to take the help of keywords and to crack these MCQ, which seems to be difficult. But honestly, if I go with the yesterday session, take my words, where the MCQs were on the easy side. Every concept was from the class notes. You have to just apply the concept, and they have given so many keywords that you can easily make the diagnosis. The first MCQ, my favorite, covered in your classroom, covered on your live app. So many times we have revised all the notes, all the important concepts of Reines and Weber. So I will start the session with the first statement. What is the statement? We have to write the possibility of Weber and rule out one with the help of Reines. The first MCQ again highlight the importance of ruling out the option. Patient hearing in both ear, bilateral, a female mention. If you are a damn student, directly jumps are, it is autosclerosis. Examiner is giving you, nothing can be more simpler than this. Examiner is giving you the diagnosis of autosclerosis, means bilateral. Patient was advised for the surgery. Which surgery we are doing? We are doing stepidotomy, which is better than stapedectomy. With the help of these 7 to 8 MCQs, I will try my best to give you important topics for upcoming NEET examination. I will try my best to give you the message how we have to do a smart learning. Autosclerosis, bilateral. Reines will be negative. It means which option we will rule out? Everybody should help me. I will rule out option A and C. We can rule out option A and C. Reines cannot be positive. I hope you are getting the message. Reines have to be negative. Now we go in the classroom learning. What we have learned? We have learned in Weber conductive deafness, Weber lateralized towards here. Examiner is telling you the patient is having more deafness on right side. Weber will be lateralized to obviously right side. Answer will be B option. I want every student sitting with me should write in the chat box. But I am showing the MCQ. You should write the answer in the chat box. Any change in the option, obviously it is on the recall basis, so any change can be there. So kindly every student sitting on this platform, help me to, if any change is there, you can write in the chat box. Clear? So right answer to the first MCQ was option B. Reines will be negative on both sides. With Weber will be lateralized to right side. Am I understand? Because it is Weber late. Yes, absolutely, beta. Dr. Arjun, excellent. It was the game changer. Your PYT and your TND, test and discussion, we have discussed all these basic points. So I will use this MCQ to give you the basic orientation. Autosclerosis bilateral, Meniere's is unilateral. So if the examiner give you, like in NEET examination, they give you the same MCQ. It will be Reines positive on Meniere's, and Weber will be lateralized to which ear? It is unilateral, so obviously it will be lateralized to normal side. But if examiner give you the typical finding of presbycusis, what is presbycusis? Bilateral sensory deafness. If it is bilateral sensory deafness, so it should be lateralized to better ear. Again, I am repeating the concept beta for your upcoming NEET examination. If it is conductive, it will be lateralized to worse ear, more deaf ear. And if it is bilateral sensory, it will be lateralized to better ear. Now here comes one of the important comment in the chat box. They ask post surgery. But even if the examiner is asking you the post surgery, after step is surgery, what is the finding? Take my word, the examiner is highlighting conductive deafness. Any other student who can confirm? They have asked this word was there. Okay, all tuning fork findings were post surgery. Post surgery, was it mentioned? Good morning, very good morning, Dr. Sandhya. It was the post surgery findings mentioned. If not, let us, very good, very nice. If examiner asks you about autosclerosis preoperative, before surgery, it will be bilateral, it will be lateralized to, you tell me, it will be lateralized to worse ear. Done. Now let us, like one of the students saying, so there was MCQ was finding on the post surgery, after surgery, if you have operated the patient, if right ear operated, it means now what will be the worst ear? Worst ear will be left ear. So Weber will be lateralized to now left ear. I hope you are getting my point. If they have asked you after surgery, definitely the there will be some change in MCQ, a change in the answer, because now after surgery, the worst year will be that year where we have not done the surgery. So it will be to the opposite side. I hope you are getting the message. Yes, madam. Confirm. And this topic we have discussed nicely. I'm just sharing one slide from my back to basic, where we have learned this concept of otosclerosis, how to revise in 1 minute. It is mild deafness, it is 40 decibel, it is heart not seen, airborne gap, in-bone conduction, right shift on the speech audiometry, plateau is achieved at 40 decibel, and very good SDS is there. There is no rollover phenomenon, no decay test, and Rini's was negative and Weber was lateralized to Versia impedance audiometry. The answer will be AS. This is audiometry finding of otosclerosis. Why I'm sharing on this platform? To give you a message, beta. In the last spell, when you have done 4 to 5 revision, you should revise the topic of otosclerosis in 1 minute. Am I understandable? Clear? Now, one of the student, yes, all here. Yes, beta. Thanks a lot for your compliment in the chat box. Every concept was there from the class notes. I got so many messages since yesterday. Everything was from the class note. The point is how you apply those class notes. It will be possible. Honestly, as a medical, I'm telling you, it will be possible to apply the class notes when you will revise, and revision will be possible when you focus on concise class notes. So just try your best in the upcoming months for your your NEET examination. Try to focus on the concise note. Now coming back to the topic, coming back to the topic, if they have asked you before the surgery, it will be lateralized towards here. Now if it is asked after surgery, it will be to that ear which is not operated. I hope you are getting my point. Clear? Very nice. Coming to the next MCQ, and take my words, beta, since yesterday, the yesterday examination proved one thing. Okay, we have to revise, then only we will be able to apply the concept in the examination hall. Coming to the next one. One of the easiest question, this I think 50-year-old diabetic patient क्या याद किया था बेटा हमने क्लास में? Diabetic patient, MCQ from ear, it is malignant otitis externa. MCQ from nose, it is ear mucormycosis. COVID patient, then examiner is wasting your time by writing lung involvement. Patient was given some steroid. Again, patient readmitted in the hospital with a nasal obstruction. From here, the ENT segment start. The patient was having some orbital swelling after the discharge. Endoscopic surgery, debridement was done. They have shown some histopath finding, and the examiner was asking the diagnosis. Even if you don't see the image, even if you have no idea of high fee without septic, with septic, hardly make a difference. I will directly jump on the mucor and jump to the next MCQ. Am I understandable? Clear? So right answer. What is the important point for upcoming NEET examination? Just remember, it have a special love for blood vessel. It have special love for nerve fiber. Therefore, in late cases of mucormycosis, there will be no pain. There will be no pain, no bleeding will be there. And what is the drug of choice? Expected MCQ, liposomal amphotericin B. That's it. Clear? So the answer to this MCQ was B option. Clear? Slide was given. Coming to the next one, this I repeated many times in the classroom. This question will be there. This question will be there. I have shown you the slide, and then I ask you, okay, what is the diagnosis in the class? Many students say, sir, it is squamous cell carcinoma. Not at all. If examiner is showing you any slide on the nose, I got many options from the student in the Telegram group, in the WhatsApp group. Okay, they have shown different. I have tried my best to give you all the possible images on this basal cell carcinoma, rodent ulcer. What is the keyword? What is the common in this slide? Common in this slide is, beta, the examiner is showing you a tumor invading the skin. If you remember, we have learned this slide in the classroom. This is not squamous cell carcinoma. This is basal cell carcinoma. Each and every topic was from back to basic segment, beta. And just your motive should be now revising these concise notes. So what I'm getting on this image, I'm getting something is eating the skin, invading the skin like a rodent ulcer, basal cell carcinoma. Answer of this MCQ was basal cell carcinoma. I hope you're getting the message behind this question. Let us learn. Now let us crack this question. Let us take this opportunity and crack this question for an upcoming NEET examination. Squamous cell carcinoma. Beta, I will go for the right answer is basal cell. I will go for squamous cell carcinoma. In which scenario? In 2 scenarios. The examiner will give me a mass coming from lateral wall. Yaad rakhenge beta, everyone revise with me. If something is coming from the lateral wall and they have shown me a maxillary sinus which is fully damaged. So बेटा काम की बात, 2 points याद रखना. If the examiner is showing you any tumor, examiner is showing you any tumor coming from the lateral wall and the whole sinus is damaged, I will go for squamous cell carcinoma. Let's see who reply in the chat box. If the sinus is intact, examiner is showing me something from the lateral wall but intact sinus, I will be going for inverted papilloma. Inverted papilloma. Malignant melanoma. For what will be the key word for malignant melanoma? Malignant melanoma, we will be getting something coming from dark brown mass. Dark brown mass coming from septum. Dark brown mass coming from septum. I will be going for malignant melanoma. I hope you are getting the message how to differentiate these options in the examination hall. Clear? Again, the question was from your class notes only. Clear? I'm just showing you these slides to give you a confidence. Ke beta, be confident, no phobia. We can't read everything. We can't apply everything unless we revise them multiple times. This was a tricky question and I want many students, I want everyone should help me in the chat box. I want many students should reply in the chat box. There was the question was same or was there any change? 40-year-old patient with history of hearing loss was given. Patient was responding only to the loud speech or sound. Some students were saying that the examiner was writing the option of amplified sound. If examiner is giving only the word amplified sound, amplified, then it should be mild. Examiner, I understand. If loud word is there, loud speech, loud sound, I will be going in the favor of severe deafness. Now, first of all, what is a classification? What is a classification? Normal is up to 25 decibel. Normal is up to 25 decibel. If it is mild, it is 26 to 40. Per ear moderate is here 41 to 60 or 61 to 80 decibel is somewhere severe, and more than 80 is your profound deafness. Am I understanding? This is what we have learned. Now, how we classify mild, moderate, severe on the basis of finding. So just remember, if the patient is within 25 is normal hearing. If the patient is finding difficulty in soft speech, like the patient, some voice is there in the background and patient feeling uncomfortable, we always go in the favor of mild. And if the patient is finding difficulty in some regular speech even at close distance, I will go for moderate. But if the word loud is there, patient feeling uncomfortable in loud, I will be going for here severe. The MCQ should be going in the favor of severe. The right answer should be severe. Now, one group of the students were telling me that they have given me mild, severe, profound, moderate. Second was percentage. If they have given you the decibel, that is 61 to 80 decibel is considered to be here severe. So if they have asked you the decibel, it should be 61 to 80 decibel. If they have asked you the definition, it should be severe. Now, one of the students, Dr. Ahmed, is saying percentage of hearing loss. I'm not getting, but can you elaborate what you want to? Yes. Was the MCQ in form of decibel or it was in the form of mild, moderate, severe? Percentage. That was decibel or percent? I'm not getting your point, beta. Can you write in the chat box, or at the end I will be sharing my WhatsApp number with you. You can WhatsApp me what was examiner was actually asking percentage in what was the options, beta. Can any student can recollect the options? Recollect the options, beta. Now, if we take 80 decibel, now if I take 80 decibel, a patient is having 80 decibel on both ear, and if we go with the calculation part, options are given in percentage decibel. So then, beta, we have to calculate the disability. That is what we are write the formula: better ear multiplied by 5 added with the worse ear should be divided by 6 to calculate the percentage. So if we go with that method, it should be around like 80 minus if both ear are same. Like now the examiner is giving you both the ear are same. So we can say, we can simplify this MCQ. If we take it around, one of the students is saying beside option severe was more than 80%. Yeah, it will be, if it is severe, it will be more than 70 to 80%, beta. Clear? So we can go with that formula. Clear? Better ear multiplied by 5 added with the finding of the worst ear. divided by 6, we can calculate the percentage, and it will be somewhere. One option was moderately severe. Dr. Saurabh, that is a mismatch. Many students are saying that they have given the option, and some students are saying that they have given hardcore percentage. If they have given percentage, you have to calculate with the formula of disability. And if they have given you just a decibel, we can go with the severe deafness. Clear? Profound deafness, they can ask you in the upcoming NEET examination, they can ask you what is the definition of profound deafness. Profound deafness, clear, is more than 80 decibel. Again, this table is very important, beta. Now just add this options in your revision notes. Clear? So this is how we differentiate mild, moderate, severe from your normal. Coming to the next MCQ, again 45-year-old male. If you have revised the notes properly, 30 to 40-year-old male complaining of moderate sensorineural hearing loss, tinnitus, vertigo. Yes, hallmark feature of all the hallmark feature of Meniere's disease given. They have given one graph. What we can appreciate on this graph, we can appreciate the graph is moving up. That is here. Always remember the rising curve. The examiner is mentioning the rising curve. That is here. Low frequencies are involved, and if low frequencies are involved, it is a hardcore diagnosis of Meniere's. Hardcore diagnosis of Meniere. Now here comes one of the option, that is moderately, or it's not sure percentage was there, but if yes, but I got this message that they have given the word moderate to severe, so it is better to go with the severe. Or if they have given you only percentage, go with the percentage. Now coming with this is rising curve. This is graph moving up. How we have revised in the classroom, beta? Rising curve is low frequency, down sloping is here presbycusis, down sloping high frequency hearing loss. Here it will be going in the favor of Meniere. So let us rule out other options. Now one of the students was saying that they have given some endolymphatic sac finding. Was they mention endolymphatic sac finding? Any student who can write in the chat box. Even if they have mentioned there is increased pressure in the endolymphatic sac, diagnosis will be going in the favor of Meniere's disease. Let's see who reply. Why we cannot make a diagnosis of BPPV? Why benign paroxysmal positional vertigo cannot be the right answer? Any student who can write in the chat box, BPV cannot be the right answer. Yes, anyone? Because the patient was having moderate sensorineural hearing loss. BPV, there is no hearing loss. Hearing loss finding is not there. Clear? So it be benign paroxysmal positional vertigo cannot be there. One option they have mentioned is an acoustic neuroma. In acoustic neuroma, what I have taught you in the classroom, beta, they will either give you ice cone appearance, some MRI finding, or they will give you histopath finding of antennae A, antennae B cell, but they have given you rising curve, which is not going in the favor of acoustic neuroma. Clear? So this patient will be going with Meniere's. Again, in acoustic neuroma, it will be your age distribution will be somewhere beyond 50-60. Clear? How to differentiate? I always say in my classroom, sensory deafness, neural deafness, these are overlapping diagnoses. How you differentiate? Whether you tell me for upcoming NEET examination, sensory deafness, they will mention the recruitment option. They will mention recruitment. They will mention the word neural deafness. They will mention the word rollover phenomena. Rollover phenomena. They will mention the word recruitment. They will mention the word rollover phenomena. Oversensitivity, recruitment phenomena, oversensitivity, Tullio's phenomena, patient feeling uncomfortable in noisy sound. All these going in the favor of sensory deafness. And neural deafness, it is rollover phenomena. Now let us coming back. Downsloping graph is in bilateral sensorineural hearing loss. One of the students is saying, Dr. Divya beta, if examiner have given you the rising audiogram was given, rising curve was given, diagnosis will be going in the favor of Meniere's disease. Vertigo, moderate sensorineural hearing loss, and tinnitus. These are the hallmark feature. Now, if examiner have mentioned the endolymphatic hydropes was an option, so it will be very close game beta. If you have to choose between Meniere's and endolymphatic hydropes, they must have mentioned some finding of the endolymphatic sac there. Clear? So answer is in this MCQ, because audiogram was given, the answer will be going in favor of your Meniere's disease. Sometimes they have mentioned the word cochlear hydropes or vestibular hydropes. So in cochlear hydropes, you will be having severe, moderate to severe sensory deafness. And in your vestibular hydrope, the patient will be having only vestibular symptom. So if the patient is having both the symptom, it will be very close choice. And I feel they should not give Meniere's and endolymphatic hydrope both in the option. So answer to this question, because audiogram was mentioned there, I will be going with Meniere's diagnosis in the favor of Meniere's disease. Clear? How to rule out, how to revise the finding of Meniere's within 1 minute. It is moderate, around 60 decibel. Again, from your back to basic segment, rising curve, low frequency hearing loss, speech audiometry, there will be right shift. Plateau will achieve at 60 decibel, rollover phenomena, decay test, all these things we have already discussed. Clear? Coming, one of the student, endolymphatic, Meniere's was not given only endolymphatic hydrope. If endolymphatic hydrope, it is obviously answer will be endolymphatic hydrope. If Meniere's word, but they will not give both the options. But endolymphatic hydrope and Meniere's we are using as one. There is extra pressure in the endolymphatic sac, back pressure on cochlea, back pressure on vestibule. We call the patient as Meniere's. So they can't give both the options. Clear? But endolymphatic hydrope is the other word we are using for Meniere's only. So they cannot give both the option. Clear? Coming to the next one, identify the joint. They have given you this joint. Again discuss in the classroom beta. Joints of larynx, joint of ear, both are synovial. Dr. Satish, is it clear if only endolymphatic hydrope or Meniere? They will give either of these two choices. They can't give both the choice. So answer will be Meniere's disease or endolymphatic hydrope, one and the same. Identify the joint. I've highlighted this point. All the joints of larynx and ear are synovial. In middle ear, inquido-stapedial, inquido-malar, saddle joint. Inquido-stapedial will be your ball and socket joint. Both are synovial. Both are synovial. Then, if any trauma, which joint will be easily damaged? Your inquido-stapedial joint will be clearly easily damaged. Clear? So answer will be your option A in this MCQ. Very one of the easiest MCQ in the and this slide taken from your back to basic, just to potentiate, just to give you the value of class notes. Coming to the next one. I hope the slide we have shared in the classroom, North Korea, yes, it helped you. Everyone, choose the most appropriate statement regarding sensory cell of the inner ear. If you remember, outer, inner hair, outer cell, army people, inner is the king. So inner, there is 1:3 ratio. Inner and outer are present in the ratio of 1:3. Absolutely true statement. If one is true statement, I can rule out option D. D cannot be there. They are asking most appropriate statement. Clear? And मुझे पूरा विश्वास है बेटा, everyone should write in the chat box. इस क्वेश्चन को देख के हमें वो स्लाइड तो याद आई होगी कि हाँ, how that king helped me to differentiate inner and outer. So inner and outer 1:3 ratio we have learned. 3,500 are inner and around 10,500, 11,000 are outer. So option 1 is true. Inner hair cell are only responsible. This word was there because I have discussed with many students. Only responsible for transmitting the auditory impulses. Not at all. The word only is making it false statement. Inner and outer, they are responsible. The friction force, the frictional force, we have learned this point. Friction force between hair cell and tectorial membrane is the driving force. So the examiner was giving you outer hair cell are responsible for tectorial membrane movement. Not at all. It is the friction between these two which is responsible for the sensory part. Clear? So option 3 is again false statement. If option 2 and 3 are false statement, I can rule out option A and B. And right answer should be inner hair cell are in a single row and transmit auditory impulses. Absolutely true. Option should be 1 and 4. Simple funda beta. Outer hair cell, just remember 5 points. The outer hair cell, they are more in number. Always remember, they are more in number. Outer hair cell, they are easily damaged. They are easily damaged. Clear? They are motile. They are motile. They are more in number. They are easily damaged. These are the important point. Outer hair cell responsible for autoacoustic emission. I was expecting one MCQ on autoacoustic emission yesterday, but it was not there. Hopefully in NEET they will ask you something on screening procedure, autoacoustic emission. So right answer should be C option. Clear? Done. Coming to the next one, the last MCQ in ENT segment. 50-year-old patient, OPD, nasal obstruction, bleeding nasal obstruction. I have revised the notes multiple times. Sir, it should be angiofibroma. But age 50-year-old patient, no sir. It would be 14-year-old boy. I will be going for angiofibroma. Now let us read the MCQ. Is reddish mass removed and histopath finding given? The examiner is giving you a nice slide of rhinosporiosis. Some students were telling me that they have given the history that the patient was taking bath in the ponds and there is some mulberry-like appearance or strawberry-like appearance or red mass coming from the nose. Again, these are the important keywords going in the favor of rhinosporiosis. The close diagnosis were either examiner will give you rhinoscleroma or rhinosporiosis. Rhinoscleroma, examiner should use which word? Let us reply. Who will yes, in the chat box you should reply. Which word should be mentioned for rhinoscleroma? They should mention the word woody nose. If examiner mention the word woody nose, examiner mention the word Mikuli cell Russell body. If I change this slide with this slide, I will be going in the favor of rhinoscleroma. But examiner is giving me something like mass coming from the nose, and this slide it is going in the favor of rhinosporiosis. Again, beta, woody nose, some foul smelling crust. Examiner is giving you Mikuli cell Russell bodies or Hebra nose or carpenter glue like words in the MCQ. I will going for rhinoscleroma. But if they have given the word mulberry like mass, strawberry like appearance, some mass, polypedal mass coming from the nose, it is rhinosporiosis. Hypertrophic rhinitis, it will be mulberry like mucosa, not mulberry like polyp. But this histopath finding is going in the favor of here rhinosporiosis. Right answer. One of the students, potato nose. Potato nose will be your hypertrophy of sebaceous gland beta. That will be your rhinophyma. That will be a rhinophyma. Is again, I will take it as one of the easiest MCQ. Clear? So these were the important concepts they have asked in your yesterday examination. Clear? There may be change in the recall options. There may be change in the MCQ. But what I have recollected in the last 24 hours, I have discussed with you. I hope this session will help you and it will again build up your confidence that we have to revise on class notes. Clear? Beta, all the students who couldn't perform yesterday, take a strong message. Beta, now after 1 or 2 days, like you just relax for next 2 days. After 2 days, like say, forget this examination, forget your performance. If you can't perform well, अगर बेटा कुछ बच्चे जो कल अच्छा perform नहीं कर पाए, forget बेटा, the exam is over. Next INICET is there waiting for you, no issues. Focus on NEET examination. Work hard 24/7 on NEET examination. Am I understandable? Are you getting this point? Your performance, if for those students who couldn't perform well, your performance should not affect your next 2 to 3 months. It should give you a motivation. It should give you a message that beta, work hard on the revision segment. And I promise you, beta, you all people who are listening to me, you dedicate. That's why you are listening to me, on this platform. So I wish very best of luck to everyone, and just try your best to crack all the upcoming examination with a decent trend beta. Yes, one of the students writing woody nose. Yes, woody nose will be going in the favor of rhinoscleroma beta. Clear? So thanks a lot for listening to me. Any other query, any change in the option, any change in the MCQ, you can discuss with me on the Insta. You can message me on the Telegram group. Thanks a lot. Very best of luck beta. Very best of luck. Yes, definitely. I'm waiting for DVT beta. Yes, we will meet in the DVT and we will revise the whole ENT in few couple of hours. That's my promise to you. Best wishes.